Hello, this is Dr. Phoenix. We're going to be looking at the vertebral column today. As we look at the entire vertebral column, we can see that from the side there are curvatures in the spine, and this is normal. These are normal spinal curvatures, and if you'll notice the curve, this is the anterior side of the spine right here, all the way down. And so you can see that the curve in the neck region and in the lower back region curves with a convexity toward the front. We simply call these the normal cervical curve, the normal thoracic curve, the normal lumbar curve, and the normal sacral curve. Again, the cervical and the lumbar curves go in the same direction, convexity toward the front, and the thoracic and the sacral curves, the convexity is toward the back. Now, if we look at the spine from the front or the back, it should look straight. And if it doesn't look straight, this is where we have a problem going on. This would be most likely referred to as scoliosis if we have a side-to-side curvature. Now, when you look at the spine, you'll notice that there are many individual vertebrae. And in fact, in each segment of the spine, there are typically a specific number of vertebrae. In the cervical region, there are typically 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. 7 cervical vertebrae. And they are named simply C1, C2, C3, C4, C5, C6, and C7. As we go further down, the thoracic spine has 12 segments, and they are named T1 through T12. T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And then the lower lumbar, or the lower part of the back, is referred to as the lumbar spine. And there are typically 5 lumbar vertebrae: L1, L2, L3, L4, L5. And then below the lumbars would be the sacrum, and then below the sacrum would be the coccyx. All right. I want you to also notice that in between each vertebrae, and this particular animation, you see nothing, but in between each vertebrae would be what's known as an intervertebral disc. An intervertebral disc. And this would be a cartilaginous structure. And I'll explain more to you about this in lecture. But it's a cartilaginous structure that serves a couple of functions. Number one, it serves as a shock absorber or a cushion between 2 segments. But it also holds the 2 segments together and allows for a certain amount of range of motion between those 2 segments. You'll also notice that in between 2 vertebral segments there is a hole, basically. This is called an intervertebral foramen. An intervertebral foramen. And you'll see an intervertebral foramen on the right side and on the left side. All right, the reason for those foramen is from those foramen will exit spinal nerves, one to the right, one to the left, and those spinal nerves will go pretty much everywhere in your body. Again, if the spine does not look straight when you're looking at it from the front or from the back, we would refer that condition as a scoliosis. Now, when we look at the spine from the side again, those curvatures that we see there are considered normal in this picture, but at times these curvatures can become abnormal as well. If, for instance, the thoracic curve becomes too deep, we would refer to that as a kyphosis. And if the cervical curve or the lumbar curve becomes too deep, which would more typically occur in the lumbar spine, we would call that a lordosis. An abnormally deep lumbar curve, a lumbar lordosis. Now, as you can probably tell, there's quite a difference in the configuration of the vertebrae in the cervical region versus the lumbar region, and the thoracic is kind of an in-between. So we're going to have to take our pick here and choose a particular vertebrae to use as our typical vertebrae, and we're going to use one down in the lumbar spine. So we'll pick this one out as our typical vertebra. All right, so let's look at it from top to bottom. And we're going to see that there are some characteristic parts of a vertebrae that would be pretty much consistent throughout the entire spine. They may look different because of size or shape, but most of the vertebrae have these particular parts that I'm going to describe to you. All right, first of all, this large segment, and this is the front part of the vertebrae, this large segment is called the body, or the vertebral body. This is what will bear most of the weight of the vertebrae. And so this is really referred to as the anterior portion of the spine. Everything behind that is referred to as the posterior portion of the spine. So these little two connecting posts, which is connecting the anterior to the posterior portion of the vertebra, is referred to as the pedicle. There are two pedicles here. As we continue posteriorly from the pedicle all the way around from one side to the other, we refer this as the posterior arch. All of this is referred to as the posterior arch or the vertebral arch. There are three long processes, as you can see here. There are two that project to the sides, one to the right and one to the left. These are called transverse processes. And the one that projects straight back is called the spinous process. And these are sites for muscle attachment, muscles of the spine, which will enable us to move our spine in different directions that would enable us to have the flexibility and the movement in our back that we have. These portions that are right in between the transverse and the spinous processes, this region right here, this is referred to as the lamina. And the lamina is often removed during a spinal surgery if a disc has to be removed partially due to a ruptured disc or herniated disc. Sometimes this is chiseled out and this entire almost posterior arch, or vertebral arch, is taken out. And that procedure is called a laminectomy. All right, now we have two pair of joint surfaces, if you will. You can see these two top joints here and then there are two on the bottom. You can see them here and here. Those are referred to as articular processes. Actually, this entire knobby part here is called an articular process. So this would be the superior articular process on the right, the superior articular process on the left. The actual joint surface right there is called a facet, so this would be the superior facet on the right and the superior facet on the left. On the bottom side, or the inferior side, we have an inferior articular process, and the joint surface is the facet, inferior articular facet, and this would be the interior articular process on the left, and the joint surface is called the facet. When we look straight down or straight up, we see that there's a large hole created here behind the vertebral body, bordered on the sides by the pedicles and the posterior arch posteriorly. This hole is called the vertebral foramen, and running down from the brain all the way down the lower part of the spine would be the spinal cord residing in here. Let me just show you now, just so that you can see, not for test purposes or quiz purposes, but just so you can see the difference between a typical lumbar vertebrae and a typical cervical vertebrae. So let me just choose this one here. And what we're going to do is, again, look at it from the top down, and hopefully you can see quite a difference here in the transverse processes. They're short and they have holes in them. Transverse processes of all the cervical vertebrae have holes in them because an artery actually runs up both sides of your neck through these holes and ultimately up into your brain. It's called the vertebral artery. So this is a unique feature of a cervical vertebrae. As well as, you'll notice the spinous process here is, we would call it bifid, a bifid spinous process. It kind of splits into two pieces on the end here. The vertebral body is smaller, obviously, because it's a smaller vertebrae. It doesn't have to carry as much weight in the neck as it does in the lower back. Now, there are two very unusual vertebrae in the cervical spine, and these are the only two vertebrae in the entire spine that have their own names. Remember, they're all called either C1, 2, 3, T1, 2, 3, L1, 2, 3, all the way down. But these two vertebrae have additional special names. And those are the top two vertebrae in the cervical spine, C1 and C2. C1 is referred to as the atlas. C2 is referred to as the axis. Now, these two vertebrae are special in their structure because they allow very specific functions to take place. And so let's look at these two vertebrae in a little bit more detail individually. So this is the atlas, and what you should be able to see right off the bat is there is no vertebral body on the atlas. This is the anterior portion right here. There's no vertebral body. We still have transverse processes here, but there is no spinous process. There is only what we would call a posterior tubercle. All right. Basically, this looks like a ring. And what we're going to see is this ring revolves around a peg that's in the second cervical vertebrae, and this peg is going to be situated right about here. And there'll be a ligament that holds it in place. And this ring will pivot around this peg. Let me see if I can show you a few different angles here. You can see that these two joint surfaces here, which are referred to as the superior articular facets, these two joint surfaces will articulate with the skull. And if you remember from the skull, on the occipital bone there are two structures called the occipital condyles. And those occipital condyles will ride right in here, and there'll be a slight amount of movement between the skull and the atlas that is allowed by these joint surfaces. This particular joint surface on the inferior side will articulate with C2, or the axis, as we'll see in a minute, and that will allow for movement to take place between the atlas and the axis, or C1 and C2. So let me pull up the axis next, and we'll take a look at it. Here's the axis, and again, you'll notice quickly that there is this peg right here. That peg is called either the dens, D-E-N-S, or the odontoid process. The odontoid process. And the dens is that post that the atlas will revolve around. So most of your rotation, most of your turning your head right and left occurs at this one segment between atlas and axis. Let's put them back together. All right, so you can see atlas and axis articulating together. You can see how the atlas would revolve around the axis. And again, there's a ligament that goes across here that holds the atlas in place to keep it from sliding forward. All right, so those are the only two individually named vertebrae. So what would you need to know? Be able to identify them from each other, the atlas from the axis. Remember, the atlas is just a ring. The axis has this odontoid process on it. And the only structure that I would really point out to you would be the dens, or the odontoid process. All right, below the 24 movable segments of the spine will be the coccyx. The coccyx is the base of the spine. Basically, all of the weight of the spine will rest on the sacrum. And I'm not sure if I just said coccyx for some reason. I'm thinking that's what I just said. This is the sacrum. And all I really need you to be able to do is recognize that this is the sacrum. There are some parts to the sacrum, but I'm not going to worry about that. You can see that the sacrum was 5 different vertebrae. 1, 2, 3, 4, 5. They fused together shortly after birth. And you can see that the intervertebral foramen are located here, which sacral nerves will exit through. You can also see that there is a joint surface on the side that will articulate with some of the bones of the pelvis that we'll learn in the lower extremity. And there's a joint surface on the bottom here that will articulate with the coccyx that we'll look at next. All right, and then down here is your coccyx. Some pull. You know what, I think I only pulled up one segment of it here the way I just did it. Yeah, you can see the coccyx has a number of segments. Sometimes they're all separate, sometimes a couple of them are fused together. But again, just recognize this area right here as the coccyx.